Thank you, Presiding Officer. I welcome this debate as, again, we can raise awareness of eating disorders and congratulate Kenneth Gibson on securing it. He has highlighted really well the issues that surround eating disorders. Around 1.25 million people across the UK, it's about 1 in 50 people here in Scotland, currently live with an eating disorder, and the numbers have increased during the COVID pandemic. The COVID-19 pandemic has exacerbated this, with a reported increase of 86% in referrals to specialists between 2019 and 2020. There is much discussion around what causes a person to have an eating disorder, and eating disorders affect people of any age, any gender, ethnicity or background. Research has shown that there is a link between eating disorders and depression, low confidence and low self-esteem. And it is important to remember that eating disorders are not all about food itself, but about feelings as well. One of the key asks from BEAT is around social media. We know that that can be the cause of eating disorders, and we need to ensure that people are using social media safely. And I thank BEAT for the work that they have done on this, and I encourage everyone to look at their website, which is totally easy to navigate and very comprehensive. Presiding Officer, in March 2021, the Scottish Government completed a National Eating Disorders Service Review. The National Eating Disorders Service Review includes a total of 15 ambitious recommendations focused on ensuring all those affected by eating disorders receive timely and appropriate care and support. These recommendations include establishing a lived experience panel, better coordination of national activity and data collection, the national availability of self-help resources, which should be available to everyone at any stage in life, and a focus on early diagnosis with the aim of prevention. It is welcome that an implementation group was set up to review timescales and cost of implementation of the recommendations, and that 3 subgroups have been created within the implementation group. And I would welcome an update from the Minister on the implementation of these recommendations. Presiding Officer, I contacted the dietetic team from NHS Dumfries and Galloway. The team has a dietitian specifically working with those living with or at risk of developing an eating disorder. And I heard that because of rurality of Dumfries and Galloway, some people who are at risk of developing an eating disorder may not be picked up as early or as easily, and they might be reluctant to access support because of travel involved in attending appointments. While this situation has improved with virtual appointments, there still exists an issue for people rurally in accessing eating disorder support services. So I would ask the Minister to ensure that rural areas are included in the approach moving forward. In addition, I also welcome the Scottish Government's investment of £120 million in the Mental Health Recovery and Renewal Fund, with a focus on improved support for mental health in primary care settings and enhanced community support. I welcome the Scottish Government's increased investment in BEAT. They've received over £400,000 from the Scottish Government to support carers, adults and young people coping with eating disorders across Scotland. The funding follows the National Review of Eating Disorder Services in Scotland, which generated recommendations for treatment across the country. These recommendations will be taken forward by the Eating Disorder Implementation Group and that are responsible for planning and delivering improvements to the eating disorder services. Presiding Officer, I am conscious of time. I know there's other speakers as well. So in conclusion, I welcome this debate and I thank the Minister for the work that's been done so far, and thank Kenneth Gibson again for bringing this debate to Chamber.